Doctor, thank you very much for being here this morning. How concerning is the surge in the Delta variant of COVID?
Yeah, good morning, Dom. It's incredibly concerning, and largely because, to be candid, it could have been preventable. We know that vaccinations really do help to not necessarily eliminate the spread of COVID, but dramatically reduce the spread and, of course, the impact on hospitalizations and deaths.
So what exactly then does that speak to in terms of the messaging around the vaccination process? Why aren't more people coming around to this notion if we are seeing hospitals overwhelmed, if we are seeing this surge in cases, tens to 100,000 cases per day now at this rate? Why are people not convinced?
Yeah, Dom, this to me is still something that should and does keep me up all night because when I talk to people, even despite images of babies not having a ventilator and having to be flown out of state, et cetera, what I commonly hear back from patients is, well, that's not very, that's rare. That's not what normally happens. What normally happens is that it's mild and that you don't really get that sick. And it's really just a rare instance compared to, candidly, the misinformation and the lies that the vaccine is actually causing worse death or worse disease. And I'm pretty stunned when I hear this, and I try to unpack some of it. But that's been a predominant theme for people who still today are not willing to get vaccinated.
So doctor, I mean, you're a medical doctor. I've had a number of conversations with lay people like myself about this notion that they're like, you know what's happening in Israel and in the UK? They saw the surge and it plateaued off and now it's on the decline. Is there a case to be made that this Delta surge is one that is now on the downswing and that we don't have to worry as much about what's happening given the vaccination efforts as they stand right now?
Yeah, the people you're talking to are exactly the people I'm talking to. And by the way, it's not just lay people. A lot of doctors and public health people are wondering the same thing because they're seeing what you're seeing in the UK, the Netherlands, other places like that, Israel, et cetera. So number one, we actually do know that a lot of the declines in the UK, for example, and in Israel are largely because of not just increased vaccinations, because that doesn't happen right away, as you know, but really because of a combination of these prevention measures. So it's not just masking. Remember, Israel went back to masking pretty early, Dom, even kind of on the upswing of their Delta outbreak. Number two, we also know that travel was pretty restricted. I'm not talking international travel, but they didn't have the school season that we're facing now and some of the other dynamics. Number three, we have seen this becoming a social network phenomenon in terms of people who are not that vaccinated. And if they get a large degree of infection, then obviously that causes their social networks to take awareness and to potentially get vaccinated. What's different about the United States, not only are we bigger, but there's a lot of regional variability. Even in Texas and Florida, you've got some parts of Texas where there's higher vaccination rates, so the transmission isn't necessarily as high. So I do think that it's multifactorial. But here's the good news, if I can put good news on it. We're doing almost 725,000 to a million shots a day. That will make a difference in the next 2 to 4 weeks. And I do think we will also see declines with it. We can't stop on that trend, though, and we have to continue to vaccinate as many people as possible here and in the world to return us back to that cusp of normalcy that we did feel in June. I know we all felt it, and it's still
Sure.
possible.